Welcome to Senior Moments, the show where we talk about all things senior, the good, the bad, and the utterly ridiculous. Today I have with me Laurie Bowhay. Hello, Laurie. Nice to meet you again.
Nice to meet you.
She is from Iron Point Home Health, correct? Mm-hmm. Right? And then you also...
we have a sister agency.
Okay, a sister agency that's hospice.
Hospice. It's American Heritage Hospice.
Okay. So should we start with Iron Point and we can talk a little bit about what you offer through Iron Point?
Absolutely.
Okay. So what is medical home health as opposed to
home care?
Home care.
Right. So good question. There's a difference between the aspect of a licensed professional, nurse, therapist, occupational or physical. We have RNs, LVNs that come out to the home. And I think of it as an extension of the hospital arm into the community.
Okay.
So you're getting the same type of care you would get in a hospital environment, but in your home.
Which is ever so much more comfortable.
It is. Who wants to be in a hospital?
Exactly. There's sick people there.
That's right. Home care, on the other hand, is more of it assists you to stay in the home longer. So they might do anything from helping you take your medication in the morning, cook your breakfast, clean up the kitchen dishes afterward, do some laundry, do some errands, so more on that level. Okay. That's home care.
All right. And you offer the whole range, right? You offer home care, you offer in-home medical services. So how would I go about engaging you?
So if you had a recent hip surgery or you're starting to fall and you don't want to go into hospital yet. Your medication, maybe you're taking your spouse's medication accidentally and they're taking yours. So you need something called medication management. So these are all different things. Wound care. So you would contact your doctor and say, I feel like I could benefit from the services that home health provides.
All right.
To get specifically in touch with our home health, you'd have to, of course, know the name, Iron Point Home Health.
Sure.
And contacting me is a great way to start that whole process. Even before you initiate the call with the doctor. I might know the doctor. I've been in the county, Calaveras, Amador County for myself personally. I've been here since 1995. Mm-hmm. I know most everyone in the county. And then as far as starting services, I could give my phone number right now, which is 916-508-9821. That's my work cell phone number.
Okay.
I have it on 24/7, literally, because people have their needs when they have their needs.
That is true.
And especially since I work also with our sister agency, which is hospice, that's a nice service to have there as well.
Exactly.
If you can't reach the nurse for some reason, call me. I'm a backup. So that number, I'll give it again, it's 916-508-9821. Right. And I'm happy to answer any questions, start that process, help you start that process. And even if you don't pick our agencies, that's okay. I don't mind being an educator, someone that can just help go through some of those questions that pop up, like, do I need home health or do I need home care? Does my parent need home health or home care? Or my sister or my aunt, uncle, whatever the situation may provide at that time.
Okay.
Yeah.
Let's say I'm in the hospital, I have a hip replacement, and generally the discharge nurse is going to come in and say, we're doing this, this, and this. In my case, I had hip replacement in Sonora at Adventist Health, and they sent Adventist Health to my home with in-home medical.
Right.
However, I didn't realize, and I was happy with it, so there's no complaint. That's not why I'm mentioning it, but they never offered me anybody else. And it's my understanding that that actually should have been my decision.
Correct. That's a really great point that you're bringing up, because it is the patient's choice. It's always the patient's choice. And unfortunately, we live in a world where that doesn't always pan out. So being aware that you have a patient's choice is something that really, it's lacking knowledge in our communities, I find. And it's difficult to choose. And so sometimes the nurse thinks she's doing the patient a service by choosing for them.
Right.
But a lot of times patients go in the hospital, even you're speaking about an entirely new medical situation. You've not had anything previously, so you're not aware of maybe your privileges as a patient.
Correct.
So that's almost unavoidable. You're not always going to get patient choices for home health or home care. But if you've been in, say you had the hip replacement, you had a particular home health come out, maybe your neighbor recommended us, something like that.
Right.
You go in back to the hospital because something new crops up, and when they discharge you home, you can say, I'd like to go back to the same home health that I had. You have to speak that to the nurse.
Right.
You have to say, I prefer to go to Iron Point.
Okay.
Or whatever other one that you were working with.
Sure.
That's not something that's just out there knowledge, but I guess now's a good opportunity to say you
Absolutely.
have that choice.
Now, I understand that hospice will work with assisted living and with nursing homes, with
Yes.
skilled nursing.
Correct.
Do you also work with assisted living in the medical care,
Yes.
home care, which...
Yeah, we do. We coordinate care. Definitely partner with and coordinate care through our local skilled nursing. And a lot of the doctors in town too, like Dr. Johnson and Dr. Esto in Valley Springs, they have preferences too, and they
Sure.
might say to the patients, you're going to go into the skilled nursing environment for 6 to 8 weeks or whatever, just to help boost you. Maybe they
Sure.
offer daily rehabilitation. That's a great situation. When you get ready to discharge home, these are some of the home health and providers in your area. And I recommend, as the doctor, this one or that one. I also go in and work with the executive directors at the skilled nursing centers so that they have met me. They can ask me any questions. They can reach out if a patient needs home health when they get discharged.
Okay.
Some of it has to do with where you live. So if you live way up in Sonora Home Health is going to be probably the top provider.
Right.
If you live way down in Sutter Creek or Plymouth, then you have other choices. You have Amador Home Health, you have Iron Point Home Health. So some of it has to do with where you actually physically live.
Sure, that makes sense.
That can help in the decision making. But you're still, as a patient, you still have first choice to say, well, I would rather have, because Sonora and Amador and Iron Point, they do a lot of overlapping.
Sure.
And provide care to the same communities. And we actually as a community benefit having multiples of these, home health and hospice. But you still have a choice as the patient.
Right.
Who you want.
Okay, so that takes care of the skilled nursing, but are there also situations where I don't go home to my private home, I'm going home to assisted living, but
Right.
I still need some physical therapy, I might still need some occupational therapy. Will you work with the assisted living as well?
Yes, we've already partnered with ones that are locally here as well. So I try to go into these assisted living, skilled nursing, rehab, and introduce myself. So right about, because I've been in the communities for over 7-8 years, in this, working with this particular home health and hospice, I've made sure that I've introduced myself to everyone in those facilities.
Oh, good.
They know me, they know my phone number, they have my cards,
Right.
they have my brochures, and they also recommend us as well.
Oh, wonderful.
Yeah, we're on their list.
Uh-huh.
So
Yeah.
you'll hear about us.
Okay. And then do you also offer home care, not the medical part, but just the home care? So let's say I'm in an assisted living community, and I do pretty well, but I'm in the more independent part of the assisted living, which means that I have my breakfast, dinner, lunch, my laundry, all my clean, all that stuff done for me. And med reminders, I'm getting my med reminders. But because it's a group setting, I'm not getting the individual care so much as I might if I needed more help, I guess. But
Right.
I'm phrasing this awkwardly, but
No, I
maybe
get you.
what my family wants is to know that at least 3 times a week I'm getting something extra.
Correct.
So is that something you do as well?
Yes. So I love how familiar you are with the basics of how things work, because you're asking really good questions. So if the family feels that there's a need for more attention, more physical therapy, maybe more nursing care, they can also go to the doctor. The primary care doctor is the one that's key.
Okay.
So, and requests, I think mom or dad would benefit from some physical therapy. They're not moving around much at this facility. So we would go out, or any service would go out, and they would do something called an assessment.
Okay.
So if it's nursing, if it's therapy, whatever the call is. So with physical, we'll go with physical therapy. So mom or dad aren't getting up and moving very well. They're kind of slow-paced, or legs aren't moving the way. They need some strengthening.
Sure.
The therapist will come out, do an evaluation assessment. It's called the initial eval. And then set up a plan of care for that patient.
Okay.
To get them on track, to get them back, there's maybe 5 weeks it depends on the insurance.
Sure.
Medicare is the best. And not the managed Medicare, the straight Medicare
Right.
is your best bet for home health. They will set up that plan of care for the patient and make sure that they're seen 2 to 3 times a week, whatever the need calls for.
Sure.
To give them that extra bump in their care, strengthening, walking. Maybe they need an assistive device temporarily or long-term to reach those goals that the family and the patient feels are lacking at that time.
Okay. And you absolutely, actually answered one of the questions I was going to ask, which is how do people pay for this?
Correct.
And mostly that's going to be your regular health insurance or Medicare
Yeah.
if you've got Medicare.
Yeah, Medicare is still number one. Other insurances, they're a little trickier.
Okay.
They require phone calls, a lot of phone calls to the insurance companies. They may say, well, it's a hip replacement. We'll give them 5 treatments with the
Okay.
physical therapist. So they have more control over how that is going to
Okay.
unfold for the patient. Whereas with Medicare, they leave it up to the professionals.
Oh, nice.
Yeah, they let the therapists and the nurses say, based on our experience, our assessments, our tools of working
Right.
with the patient, this is what we feel they're going to need to establish a good plan of care and to help them achieve those goals.
Right.
At the end of that plan of care, they have the option to turn in another assessment evaluation and say, we really should go another 2 or 3 weeks. They can
Right.
make it, do an extension.
Okay.
Yeah. And that's covered by your insurance. With managed care and other insurances, there might be some out-of-pocket expenses.
Okay.
Yeah.
Yeah, that it's tricky. It's
It is
tricky.
tricky.
The whole Medicare landscape is tricky.
And it's changing,
Yes. Heaven forbid we get used to something.
right?
Yes. Let's switch gears a little bit and talk about hospice. So
You bet.
please remind me of the name of the company again.
American Heritage
American
Hospice.
Heritage Hospice. Okay. And how do you interact with them?
Same. So I have the same relationship. My skills are called a liaison.
Okay.
So I'm a liaison between the agency and the patients, or the other skilled nursing and other facilities that we've mentioned, and also with the family practice doctors.
Okay.
Sometimes with the specialists as well, depends on the case. But once a patient goes on hospice, they're going to relinquish all other doctors. This is a decision where you're going to let go of all treatments that are going to keep prolonging and extending your life. You're saying, okay, enough is enough. I'm ready to just let go and live my life with my family, or whatever the precious moments
Sure.
are that you'd like to have around you at that time. And we have a nurse that goes out. She provides pain management or whatever is needed at that time. And you kind of get situated in a nice little cloud
All right.
of care and comfort.
Yes.
And also that includes spiritual care if you request that, whatever the needs are at that time.
Okay.
This is a time in a person's life that I look at as it should be between you and your family, you and your spiritual needs, and we try to, with American Heritage Hospice, we try to package that all in at this
Okay.
moment and respect and honor this as a very special time in a person's life.
Okay. So going back to the assisted living situation again, at that time, the assisted living community will quit doing the med management. It will be turned over to hospice.
Correct. And we do have a doctor who is dedicated to our hospice patients.
Wonderful.
So he's a hospice doctor, specialized in this, very knowledgeable, and he oversees everything. So the nurses aren't just free ranging,
Sure.
they have to follow a protocol. And the doctor is like the supervisor of everything.
Oh, absolutely. Okay, so let's say that I have lung cancer, and that is why I'm on hospice.
Correct.
But today I get up and boom, down I go and break my leg. Can I go to the hospital?
Absolutely.
So what happens then?
So you're going to go into the hospital. The information, documentation that you're on hospice is going to go with you, travel with you. That
Sure.
will be a knowledge transferred to the hospital care. You'll be treated for that because you're not going to be allowed to suffer
Right.
or have any of those scenarios. You will get that taken care of, and then when you're ready to return back home, you will go back home. But during that time of care in the hospital with the broken leg or whatever situation, you will be treated for that. If it's related to your cancer, I was going to say oncology, but not everyone understands that. If it's related to cancer specifically, there won't be treatments given to prolong your life unless you say, you know what, I don't want to do hospice. I've changed my mind. I want to go
Right.
back and receive care again and try to beat this or whatever your goal
Sure.
is. So you still are in control of which way things go.
And I have heard that people actually have gotten kicked off of hospice
Yeah.
because they started getting
They
better, which
got
is yay.
better.
Yeah, which
Yeah.
is good. Yes.
Absolutely.
So, and it does get a little tricky if I'm understanding this correctly, because when I go to the hospital for my broken leg, which has nothing to do with my cancer, I go off hospice while I'm in the hospital, and then I come back on hospice when I
Correct.
get back off, so
Yes.
nobody can be accused of double dipping.
Right. So that's all within the billing.
Okay.
We're speaking now of a different program is the billing.
Sure.
So it's a necessary treatment. You need to go off hospice to receive that treatment, covered by your insurance, or
Right.
however your insurance works. And then once you're done that treatment, if you're still, I want to be back on hospice right away, get me back on, we just transition you back.
Okay.
We actually kind of pause your care. It's the best way I can
All right.
describe it. You're still, you're not going to have to start over.
That's good.
We're just pausing your hospice care during that treatment
Okay.
session, and then you'll come back.
Sure.
If that's still your wish.
Yes.
Yes.
That is really good to know, too, because I do know people that put off going on hospice because they felt that once they did that, they were giving up and they were going to die
On it,
like
yeah.
tomorrow.
And you know, you're right. A lot of people think that. In fact, our office is planning to do an educational we're getting towards the end of the year, so it might not be until next year, but we're planning on doing one. We're going to look for a location, invite anyone that's interested in the community to come. We'll serve some, little snacks and drinks and things, and then we'll discuss this. We'll have a doctor present. We'll have some hospice nurses present, just to kind of do an educational on how hospice works and have people free to ask all those questions.
I think that's a great idea.
I think so too.
Now, talking about the billing again a little bit. Now, I understand Medicare and it picks up hospice, but what if I'm 50 years old and I'm not on Medicare yet? And I have health insurance. Does my health insurance generally pick that up? Or does Social Security pick it up? How does that work?
Specifically for hospice?
Yes, specifically for hospice.
Yeah, that's a case-by-case scenario. And it just depends on your insurance. And I'd literally have to be an insurance expert to tell you, because I don't want to mislead anyone.
No, I'm not asking you to.
Hospice is provided for any age, children on up to end of life, whatever age. So you have that. It's available to everyone, but it's on a per basis, case by case. Your diagnosis, your doctor, everything's involved, and how your particular insurance covers that.
I see.
And that's up to the insurance
Oh,
companies.
absolutely.
You're right.
Absolutely. I just didn't know if there was a kind of a general rule
Yeah.
for somebody that's not on Medicare, put it that way.
Right. No general rule that I'm aware of, but just
What about
case by
Medicaid,
case.
though? If I'm on
Medicaid
Medicaid, I'm
helps.
50 years old and I'm on Medicaid.
Yes, Medicaid, MediCal. Even there are a lot of ways that that help financially manage that need.
Okay.
Yeah.
Well, very good.
Thank you.
So, is there anything we haven't talked about today that we should be touching on?
I think one of the outstanding benefits that our companies provide, when we hire a nurse for home health or hospice, we will talk to that nurse during the interview about how they feel about the other. So if they're hiring on for hospice, how do you feel about home health nursing?
Okay.
If they're open, we will cross-train those nurses.
Oh, nice.
And it becomes very important if they're hiring on for home health and they would like to cross-train for hospice, because if a patient comes on for home health and they want the same nurse if they're transitioning to hospice,
oh, that would be wonderful.
they can have that nurse who sometimes they become part of the family, honestly, because they're seeing that nurse 3 times a week.
Oh, absolutely.
And sharing, very personal, intimate information and back and forth. So we like to cross-train the nurses that are interested in doing that. And quite honestly, most of them are.
Okay.
They might not have come to the interview thinking about the other.
Right.
If they're hiring on for home health. But when we bring it up, just because of the heart that nurses have, that's part of it, I think.
I think so.
They become interested, and then either then or later they're into the cross-training, and then they're available for both.
Okay. Now, this is maybe a silly question, but still got cancer. But now I'm back on, my leg's healed, but I'm not as mobile as I used to be. So can I still be on hospice and get physical therapy at home?
We limit that to, if it's going to help do simple things that in the house, like transition, if you need to transfer from the bedside to the bedside commode.
Correct.
Or to a wheelchair. But we're not going to have, somebody coming in there like they would if they were on home health, trying to mend the leg, trying to gain as much strength as possible.
Right.
To ambulate, out to the car and things like that.
Okay.
We will do what's necessary for safety.
I see.
As well as to care for the caregiver in the home. So we're not going to add to their burden by saying, no, we're hands off physical therapy for that.
Okay.
Because that just adds too much burden to the caregiver.
Right.
Now they're going to have to work twice as hard to transfer their loved one from a chair to the bedside commode or to their wheelchair, things like that. So we factor in all of that.
That makes sense.
Right.
And then, of course, if I have a family and I want to become more ambulatory, I can always do exercises on my own. So
Absolutely.
It's not like you're
Yes.
just stuck. You
Right.
you still have options.
You
They're
still
just
have a lot of options.
a little more work.
That's
maybe.
right. But just remember that everything that we have to look at everything from the insurance standpoint, the medical standpoint. We have to factor in other things, whereas you're free to, like you said, to have those options to do it yourself,
Exactly.
to have your family help you out. So,
All right.
yes.
Well, thank you so much for coming today. This has been
Thank you.
fascinating. I learn something each and every time I talk about this subject. It's amazing. It's complicated, and it's just really important, I think, for everybody to understand.
Yeah, it
What's
is. It's a lot of
available.
questions. And like I said, my phone number, I'll give it again, 916-508-9821.
And how
Reach
about-
out to me.
Okay, and a website? Do you want to give a website?
We have a website on my brochure. I think it's just Iron Point Home Health, but yeah, Iron Point, and then it's HHC to kind of take the home health care and
Make it smaller.
shrink it down. So
Right.
ironpointhhc.com.
Perfect.
Right.
All right.
Well, I thank you. I appreciate this service that you provide for our community.
Well, thank you.
It's wonderful. Thank you
Great.
for your time, too.
Oh, you are welcome. And thank you to our audience today. I hope you enjoyed this conversation as much as I did. And please remember to join us again next time.